Good morning and welcome back to NWR's virtual conference on day 2. This morning we start off with an upcoming ASX listing of Doctor Care Anywhere. Doctor Care Anywhere is a UK-based telehealth company that operates across areas including primary, secondary and remote care. The company's model uses its tech platform to provide joined-up care across the patient journey and deliver better outcomes for patients, payers and clinicians. The company's recently just announced plans for a $102 million IPO that's set to open in a few weeks, and it'll have a market cap of about $255 million upon its ASX debut, which is expected in early December. From the company today, we have Baiju Thakkar, the CEO and co-founder. Dr. Thakkar trained as a medical doctor at King's College in London and then practiced in general and emergency medicine before a move to consulting at McKinsey & Company. McKinsey worked across public, private and emerging market health systems in medical devices, pharmaceuticals and information technology industries. Just a reminder before I hand it over to Baiju that if you did want to ask a question, please do so via the Q&A box at the bottom of the screen. But I'll pass it over to Baiju to get started. Thanks very much.
Thank you very much, Simon. And thank you to everyone who has joined this morning, your time, evening, my time. I think the first thing I wanted to say is generally thank you for taking the time. It's a very odd time as the UK goes back into lockdown and the American elections rapidly going on amongst us. So strange times in the world. But what is not strange so much, I suspect, is healthcare. Healthcare is something that is an ubiquitous need for all of us, no matter how much the political environment changes amongst us. So I'm delighted to be talking today and very grateful to NWR who've given us this opportunity, and thank you to all of you who have taken the time to listen. What I thought I would do is just give you a 10-15 minute overview. If there are any questions, happy to answer them, about what we do and why we do it and what we hope to achieve. So I will kick off, and I'm not going to use any PowerPoint slides, and I hope not to bore you, but please do ask questions if you have the chance. So you will know that we've all gone into lockdown in the UK, I suspect, which is why I'm at home in the environment I'm in. But I am, as Simon said, I'm a recovering doctor for my sins, and the founder of Doctor Care Anywhere, ex-McKinsey person from about 10 years previous. And fundamentally, the thing I wanted to share with everyone today is what is the problem we are trying to solve in healthcare? There are lots of health tech businesses in the market globally. And the real thing for me, the real problem that I want to communicate is that healthcare is fee for service. Healthcare is something that we pay for on activity. And this is a massive problem. Healthcare should be paid for on clinical outcomes, but we are unable to commission healthcare on outcomes because healthcare is so fragmented. And by that, I mean we're unable to understand that when you as a patient present to us as doctors, we cannot possibly know whether what I decide at the beginning of your journey and what I decide to do has the right outcome we want at the end. Because every health system in the world is fragmented. And every health system in the world is fragmented. And this is what I mean by this. One, it is fragmented geographically. It is fragmented financially. And it is fragmented simply from a patient journey point of view. So let me explain that. If you've ever used healthcare, you will know that primary care is segmented from diagnostics, is segmented from secondary care. That means you have a terrible patient journey. You have to go from pillar to post. You have to move from different places. And in all those different places, there are separate budgets in those different places, which means people have perverse incentives. They want to hold those budgets and they are incentivized to behave in a certain way. And you have separate patient records. That means clinical data is not shared, which makes things risky, which means we don't get the right clinical outcomes. That fragmentation fundamentally means we cannot do things on a value-based system. So we at Doctor Care Anywhere decided to build a telehealth business, a digital healthcare business that joins up the system And we did that in 2013. And in 2013, we said, we're going to address that issue of fragmentation, and we're going to build a platform that brings together primary care, diagnostics, secondary care, all under one platform, all under one electronic health record that provides pure transparency for everyone, employs our own doctors, and effectively builds a new health system in the cloud for our patients. So we get rid of all those problems and can move to a value-based healthcare system. And that is what we've done. We at Dr. Care Anywhere have built a proprietary tech platform, hired our own doctors, built the platform that joins up primary care, diagnostics, and secondary care in one place. So it's not Zoom for doctors. It's not just a place you have a video chat, but it's a place that you can go online on your app. You can get hold of a doctor at your convenience, choose who you want to speak to. Not only that, but be able to access your own patient record, be able to order diagnostics, be able to have those diagnostics in one place, have a specialist consultation in the same platform, get your management plan, get the prescription delivered at home, all under a secure GDPR, DPO environment that knows your data is safe and everything is one place, coded ethically and from a healthcare perspective, joined up healthcare in one place. And it is making a massive difference to our patients. We now serve over 2 million patients. We go to market in the UK through channel partners. So we serve health insurers, we serve large hospital groups, and we serve brokers covering that 2 million patient base. We conduct now over 20,000 consultations a month, really about 23,000 consultations a month. We charge on a consultation basis, but we save huge amounts of money for payers downstream because of our transparency and everything on being on one platform and controlling diagnostics. We're able to save insurers money, which saves them about 20% of their claims costs. And we have entered a joint venture with insurers in the UK that's now saving hundreds of millions of pounds as a result. And we have now, having done that, having served those 2 million patients, conducting 20,000 consultations or so or more per month, we're now generating about £1 million in revenue per month, about a 50% gross margin, have an NPS score of about 80%, and we have about 350 staff, of which the majority are software engineers, management, and about 120 are clinicians. So we have really made a step change in the UK health market, the private market, not the NHS, in how healthcare is received, and have made a massive difference in joining up fragmentation by covering those lives, bringing primary care together with diagnostics, with secondary care, and making a difference to how people receive their healthcare through the modality of video and phone under a single electronic patient record. We have huge ambitions for the future. Given COVID, clearly the time is now to expand, and we're looking to expand further from diagnostics and primary care and specialist care into mental health, into virtual specialists, and of course, internationally with different partners. One of our major partners being AXA PPP, which is the largest health insurer in the UK, but one of the largest financial services businesses in the world, who have a footprint in many European countries and Asian countries where we look to expand over the coming couple of years. And that is why we are hugely excited about our IPO in Australia, raising money so we can drive further growth from where we are today. But that's just a quick snapshot summary. I know that time is short, so I just wanted to be snappy and happy to answer any questions if there are any.
Great, thanks, Badru. And just a reminder for those on the webinar, if you did have a question, just the Q&A box down the bottom, and we'll get to them. The first question is, what's the step-by-step process and timeline for expanding into other specialist and mentalist health services?
So we've already actually launched a mental health service, and that was launched on Mental Health Day on October the 10th. As you guys will probably appreciate, what is frankly quite sad is that the mental health needs of global populations has increased massively as a result of COVID. 10% of our population come to us as a result of mental health. 40% have an underlying mental health condition, and that is increasing day by day as a result of COVID. So we launched our mental health service on October the 10th. We'll look to invest in that significantly, introducing digital therapeutics and so on and so forth over the coming months and years, and push that out in the market. In terms of international expansion, it is something that I am very keen on doing, because this is the time for telemedicine. We've already launched in Ireland, we've already launched in Luxembourg, we've already launched in Guernsey. So we are now out in Europe. We have a European base and able to manage European patients above and beyond Brexit, which of course many of you will know is happening for us in a month or two, but now we're able to serve these European countries despite of that. We'll look to focus on the Irish markets. I'm hugely keen on the Australian market, but there is work to do for us to investigate and understand that. But I'm certain in 21 we will have a clear answer about when and how we will enter the Australian market. It's something we're very keen to do.
Great. Next question, and you might not be able to answer this, Badru, so no problems if not, but can you provide a most recent update on eligible lives, activated lives, and virtual GP volumes?
I certainly can, up to, and of course within our perspective. So we have over 2 million eligible lives, and we have just over 320,000 activated lives, and we're doing quite considerably north of 20,000 consultations per month. So we're trending pretty well in terms of our forecast this year. What is important right now, if you look at that, and you're doing the analysis, there is about activated lives are about 14-15%, where I want to get to over time is of course much higher than that. If you think in the UK, the average number of GP visits are 3 to 5 per annum. So there's no reason why we can't get to 70 or 80% activation and 100% utilization, or indeed 100 or 200% utilization. And if you took for our 2 million eligible lives, let's just say we managed to get 50% activated, that's 1 million people who are activated, who all had one consultation each or 2 consultations each, let's say, that would be in itself 90 million a year revenue. So there's huge scope for growth for us, just in terms of driving further activation and driving further utilization.
Great, thanks, Badru. Again, might struggle to answer this question, but your growth in monthly consults has grown very strongly over the last 6 months. So you're able to provide some insight into the rate of consults seen during the month of October. From memory, during September, you were doing over 1,000 per day. Presumably the UK lockdowns have the potential to result in another step change.
Yeah, I think the lockdown, what we're likely to see is a continuation of the trend that we've seen as a result of that. The step change has already happened within the UK, which is we went into lockdown in March. People suddenly realised that they didn't want to go out to get a doctor, and then they use services like ours to get hold of a doctor and to get diagnostics and to get into secondary care, which is what we do. We join up the whole pathway, and that adoption curve has now shifted, where in the UK it went from 15% were doing that to 75% now doing it that way, and that's already happened. So going into a second lockdown, although it's just a continuation of that particular behaviour, and it's important that both doctors and patients are behaving in that way. So I don't see a significant difference as a result of a second lockdown. I just see a continuation of the trends that we've already seen for the last 8-9 months.
Great. And aside from international expansion, at what revenue level do you expect to break even in the core UK business?
So when we look at break even, is probably what we talk about here is about 45 to 50,000 consultations per month, including our diagnostic service. So bearing in mind we're at about 20 to 23,000 consultations a month at the moment, so it's about double where we are at the moment, and we've grown about 350% over the last year. So as trends continue, it's fairly easy maths to work out where we think we're going to break even, but it is about 50,000 consultations per month is our break even point on the core business, which is our virtual GP business plus diagnostics.
Great, thanks. And what is your customer acquisition costs? Who are your competitors and how do you differentiate?
Yeah, so the cost of customer acquisition here is a little bit, we don't really think about it that way because we go to market through channel partners. So we don't go to market as a B2C business. We go to market through channel partners like insurers, like AXA PPP, or hospital groups like HCA and so on. So we don't have a sales force. We have account management teams who work with those channel partners, and through our service, particularly for an insurer, where we provide a GP and diagnostic service, it's saving them huge amounts of money downstream in their claims costs. So, let me just explain that. If you were using my service and you had a bad knee, you would do a consultation with one of my GPs, having opened up the app on your phone, booked a consultation of your choice, done the video consultation. In the electronic patient record, the doctor would have typed in what your symptoms are. An algorithm would have popped up what they think you should do next. We would have ordered an MRI scan as a result of that. The MRI scan would go in the cloud on our platform. We would read that with my consultant reading it, and then we'd make it a decision as to what should happen based on the evidence base. It's all transparent. Now that saves the insurer huge amounts of money because I haven't had to send you to an orthopedic surgeon. I haven't had to send you for lots of tests that you didn't need, and there's no perverse incentives to operate because I can do everything remotely. And that saves the insurer about 20-odd%. And that is why AXA, for example, guarantee us, and they guarantee us more than 8 million sterling a year just to do that, for example, because we save them 20% downstream. At least we are, that is what our relationship is based on, is their belief that we do send them, save them a whole bunch of money on their claims costs. And that's why they're paying for that. So the cost of customer acquisition issue isn't a big issue for us because we're going through channel partners, and it's how we impact the economics of our channel partners.
Great, thanks. In terms of listing on the ASX, why have you chosen Australia as opposed to US or UK?
Yeah, it's a good question. I think if I just step back, we didn't first think about whether we list in the US or UK or Australia. We thought about, do we want to be private or public? And that was the first debate we had at the board. And that was a lot about, when COVID came along, it really shifted the dynamic in digital health and telehealth, made it, this truly is the time for this industry. And we wanted to be in a place where we had access to capital, were well known, and we thought this was the time to go public, despite being a relatively small business, and we understand that. And then when we'd made that decision, it was like, well, where do we go to? Hong Kong was off because we felt that Hong Kong was really China. We were too small for NASDAQ, but we had two really important board directors who were Australian, Roger Allen, David Ravek, and one of them was a co-founder with me of the company. He was like, look, have a look at Australia, because the Australian Stock Exchange is a huge supporter of fast-growing tech businesses, small tech businesses, and will support your growth as you look to expand internationally. And that's exactly what we did. We had a look at them, we compared them with AIM, we had a look at what the differences were in terms of appetite, relevance to our strategy, and relevance to the fact that we had Australian board directors. And AIM just didn't really cut it compared with the ASX. And the ASX has proved to be somewhere that we wanted to list, has the appetite for small growth businesses, a great platform for us to expand into Asia, and suits the culture and what it is that we want to do in the speed we want to do it. So we're delighted and both humbled by the interest that we've seen from the ASX.
Right, thanks. And what's the difference in referral fees between a referral to a Doctor Care Anywhere specialist versus a non-employed specialist?
Well, we don't charge referral fees. So the way we make money is we make money for doing a GP consult. So let's say you have knee pain, you will do a GP consult with us. We'll charge you for the GP consult. We'll then send you off for an MRI scan. We will get a rebate from or commission from the MRI scan that we send you to. We'll then have one of our specialist consultants read the scan. We'll make a fee off that. And then our GP will review the management plan and do a follow-up consultation with you, and we'll make money off that. So a single episode of care, for example, that care that I just talked about would be about £200, and that's how we make money. We don't make money from referring or prescribing, because that drives perverse incentives. In the clinical world, if you make money for referring into hospital or for prescribing drugs, you're naturally going to drive bad behavior, and that's not what we do.
Perfect. Can you talk about the prevalence of virtual GP services in other European countries compared to the UK?
A little bit. I'm not a European expert. I have some sense of what's going on, but I'm not an expert in it. Scandinavia has shown a lot of development and growth through a company called Kry, K-R-Y, which also has a subsidiary called Livy in the UK. They have been quite successful in the Scandinavian markets and also successful in the NHS in the UK, and I have to say quite a good platform and excellent service. There are small businesses throughout Europe, so you'll find small players in Spain, France are companies like Care and Germany, but the major players really are Livy, Babylon, and probably ourselves, if I'm allowed to be so unhumble to say such a thing, in the European market. But there are a number, 47 at my last count, of small players who are emerging both pre and post-COVID, which probably indicates that the market will be ripe for consolidation over the next 18 to 36 months.
Great. Can you offshore your medical service employing overseas doctors?
Sorry, I missed that.
Can you employ offshore medical service employees?
Yeah, we do. So we have, so if you're providing services, it depends on where the patient sits. And that's what determines the regulatory environment in which you sit. So we employ right now as a UK business, UK doctors who are all GMC, that's a General Medical Council, effectively NHS register list. But if they live in Hawaii, they live in Hawaii. Or if they live in Canada, they live in Canada or elsewhere, or Australia, for example. So we have a number of UK GMC registered doctors who live in different places. And that allows us to run a 24/7 clock, and they're all on the UK registry list. If you want to hire someone, and that allows me to treat UK citizens wherever they are in the world. So if a UK citizen is traveling to Spain or China, for example, they can use our service, which is why we serve the IPMI or travel market. And our Irish service, for example, has Irish doctors that allows patients in the European market to see those Irish doctors, and we can prescribe in Europe. So what you have to do is just adhere to every regulatory market and understand where the patient is and where they came from, and have a doctor who is registered accordingly to that particular market. There are complexities around it, but there's something that we have got quite good at managing.
Right. And has the service with HCA Healthcare gone live? How should we think about the significance of this agreement? For example, what's the pool of addressable lives who wouldn't have access to telehealth through their existing health insurance?
Yeah. So the insurance market that we have at the moment, and the AXA market, is about 2 million lives. The total insurance, private insurance market is about 7 million lives. Our relationships with HCA, Nuffield and Perkbox probably open us up to another 2 million lives. So it's double what we already serve today. We have contracted with them. We've built an app, both Nuffield, HCA and Perkbox, as it happens, 3 major providers, not just one, who do open us up to double where we serve today. And we'll be really driving that forward through 21 to make sure that we get some diversification over the coming 12 to 18 months.
And just an extension to that question, who are the major health insurers you do business through?
The major health insurers in the UK, who own about 90% of the market, are AXA PPP, Bupa, Vitality, Cigna and Aviva. AXA, who are our preferred partner, own about 30% of that market. Bupa own another 30% of the market. They're the major players. AXA is our major insurance partner. We are not permitted to directly serve the other insurance partners. So in order to get access to the other patients, we have to go through different channels, like the hospital groups I just mentioned, or the flexible benefits brokers I just mentioned, like Perkbox or Aon, who we serve, or indeed through the self-pay markets that come through to our channel. So in total in the UK, there are about 10 million people who are accessing self-pay. We already have captured 2 million of those particular patients. And on our estimations, there are about 5 million additional to that that's available to us through our other channels that we'll need to work through over the coming years.
Great, and thanks.
That doesn't, but by the way, that doesn't include the international expansion plans we have.
Yeah, of course. We've had a number of questions that have come through, which we won't be able to get through, but I'll ensure we get answered on the other side. But last question, Baiju, what's the nature of ongoing tech development spend?
So yeah, it's a good question. Let me have, sort of put some real numbers on this. Our tech part of our business is about a third of our workforce. So if you imagine when I said we were about 350 odd, you would imagine product and tech is about 100 odd people, and that will be where the most intensive spend is over the next 2 or 3 years. From my perspective, as I'm going through what we're looking at the moment, I would expect 30 to 40% of our spend will be there. Why is that? You have to remember, as telemedicine really emerges as the front door of every healthcare system, and that's what's happening at the moment, is that digital healthcare, if you don't have a digital healthcare capability, you will not be the front door of the healthcare system. But that also commoditizes things. So the important thing basically means that all the players in this space need to make sure the journey and the technology is absolutely phenomenal and stays up to pace with advances in technology. So we will be investing quite significantly to ensure that our patient journey is amazing, our electronic health record is absolutely spot on, and unlocks new revenue streams. So 20 to 40% of our spend going forward, of our capital spend, will be on the technology and product business, but it will be unlocking far more revenue than it will just investment.
Right. Thanks very much again for presenting, Baiju, and good luck with the ASX listing. I'm sure it'll be a great success.
Thank you very much for having me and everyone's time. I appreciate it.
Thanks, guys.